Harris Health System for years now has been forced to underinvest in our infrastructure. You have heard the horror stories about the issues that we are having in both of our public hospitals, which I need to mention this. Harris Health System operates the one of only 2 adult level 1 trauma centers in the 3rd largest county in the United States. This county by population needs at least 6 or 7 trauma centers. We are managing one of only 2. With these decrease in funding, and I did a quick calculation, what the no net revenue means to us compared to the budget that was proposed last week at the Commissioner's Court, that's a $125 million loss. $125 million loss. What that means, we are not magicians. What that means is cutting services to tens and thousands of people who rely on Harris Health System as their only source of care. But really important to also mention that Harris Health System, you heard from Bill McCann at the tip of the spear. We are not here to only care for the uninsured and underinsured. We are privileged and proud of that fact, but we care for the entire Harris County. And when you take away those funds from us, that's care that the entire county is not going to receive. And you saw in the letters that you had received from the TMC CEOs, and that's true. When we have to reduce our services, that pressure is going to be felt on the entire county system because that care has to be provided somewhere. As of today, with the current funding, Harris Health System is able to provide care to 250,000 unduplicated individuals in Harris County. We know for a fact that there are more than 1 million uninsured individuals in Harris County. So at the moment where Harris County is looking to expand its capabilities, expand its access to care, we are being asked to actually reduce care. Judge, you mentioned the 3,000 people who are now waiting for colonoscopy. That number was close to 7,000 2.5 years ago. We have been able to very slowly chip at that number. 3,000 people waiting for colonoscopies. By logic, a portion of that 3,000 currently have early stage colon cancer. Those are the colon cancers that are going to go undiagnosed, unfortunately, until they show up at the late stage presentation of colon cancer, which is going to cost a lot more to treat, and unfortunately is going to result in unnecessary deaths. That's the reality that we're being faced with. You also heard about the people who are now receiving dialysis outside of Harris Health System because we don't have the capabilities, the capacity. Well, with this decrease in funding, those people are no longer going to be able to receive dialysis. What that means is that those people are going to now be showing up to the emergency rooms, not just at Harris Health System, but all emergency rooms across the Harris County when they get sick enough to require emergency dialysis, which again costs a lot more for taxpayers to provide care for, but also results in increased morbidity and mortality, unnecessary deaths. So those are just a couple of examples that I wanted to share with you. And you also heard about the last couple of years. Bill McCann said it beautifully that over the last 2.5 years with COVID-19 and everything going on, what the health systems and our healthcare workers had to go through. Not long ago, everybody was calling healthcare workers, the heroes that they are. Today, this is not the way to repay those heroes. This is not the way to pay gratitude to those heroes that took care of the very sick in this county, but putting them in a position that they have to decide who are they going to care for, what type of care they're going to provide. And this is really not the way to take care of our public. We're talking about their overall wellness being at risk. One more thing, Judge, what this means to us, a loss of $125 million. The no net revenue puts us at a negative margin. What that means to a hospital system is that it actually hurts our credit rating. That is very important. As we are looking at replacing both of our hospitals that are very, very quickly approaching their end of useful life. With a negative credit rating is going to cost us a lot more money to be able to borrow money. And more so than that, if the situation ever arises that our credit rating actually goes below our debt obligation rate, Harris County is going to be on the hook. Harris County, as the parent entity, will have to actually put in money to replace that debt ceiling that we're not going to meet. So this is a huge cascade of events that is unfolding in front of us. And Judge, you said it correctly. Over the last 3 years, our tax rate has been cut twice. Annually, that has meant $50 million. If we are no longer going to receive that, $50 million is in perpetuity. It's from now forever. This $124 million loss is not just a loss this year. Next year, even if you went to the voter approval rate, we're still not going to be able to fill the gap, the hole that this is going to leave for us. And it is very frustrating. I'm sorry that I'm getting a little emotional, but it's just unimaginable for me coming out of the COVID pandemic that Harris Health System is facing this situation again. I don't think it's a secret to anyone, so I don't mind sharing with the public. Actually, this has been a chronic issue, but the last couple of years especially last summer, LBJ had repeated failures in this plumbing, cold water, hot water, and steam. And we actually had injuries to our employee and our patients. It has taken us a lot of investment in a hospital that is obviously open and running, trying to only fix, not really fix, repair the building to the point where we can continue to care for our patients. But we continue to have, every time it rains, we continue to have flooding. We continue to have backing up of sewer into our pharmacy, into our patient rooms. Not for the lack of trying to repair and fix these things, but it's very, very difficult to fix an airplane while you're still flying it. Yes, we could shut down the hospital and try to fix it, but where are those patients going to go? So we have all these issues, and really, and again, I don't mind sharing this because I think I've said this before. Commissioner Ramsey is the one who told me that you can spend all hundreds of millions of dollars on that old hospital, but at the end of the day, you have an old hospital on your hand. So you're throwing good money after bad. And I appreciate that, and he's right. So yes, we are looking into replacing LBJ Hospital. We're very excited about it. We plan to take to the voters next year a very aggressive bond referendum to replace not just LBJ, but in about 10 or 12 years, Bentop Hospital as well. And the reason for that is because we need it. The people of this county deserve better, regardless of their insurance status. We continue, Harris Health System continue to still have multi-occupancy rooms, patient rooms. That is no longer up to code. The only reason we're still able to operate is because we have been grandfathered into it. We can't create a lot of things that we want to create inside the LBJ because as soon as we touch the building, we're going to have to bring the entire building up to code, and we can't do that. So this is the situation we're dealing with, and to be then dealt with this reality that if this stands, 3 out of the 4 years, our tax rate has not been increased, but actually cut. That's just a difficult pill to swallow.